it's the order that the arteries come off, because sometimes people get, when they're learning the arteries, they're like, we can't find this one. And I go up and go, oh, it's right here. How do you do that? It's because you have one of these, and I can go up and go, well, it's got to be above that one, but below this one, as far as their order come off, because their order is pretty consistent. 80–90% of them are pretty consistent. So South-PMST has to do with the artery that comes up, the carotid artery comes up and splits, okay? And the artery that comes off here, the internal carotid artery has how many branches? None, right. No branches of the internal carotid artery. So all of these are branches of the external carotid artery. Okay? And the first one is the superior thyroidal, goes down to the thyroid, okay? Ascending pharyngeal comes off the back of the external carotid and ends up going up into and goes medially up behind the esophagus. Wrong one. I was like, M. So, the next one is lingual, that goes up and goes right up underneath the tongue, okay? Then the next one also comes up and crosses over the face, facial, okay? The occipital comes off the back and goes up across the back of the skull. The posterior auricular comes off like that, so it's just behind your ear hole, okay? You go up behind the back. That's posterior auricular. The big one coming off here is called the maxillary, and it disappears into your face, and there's a whole thing about just the branches off the maxillary. So that's the big one, maxillary, coming off the front there. And then S is the rest of it, called the superficial temporal, okay? Now, a branch of this coming across the face here is called the transverse facial. Some people have it, some people don't. Some people see it as a branch off of the superficial temporal artery. Some people see it as its own branch. Okay, and so that's South-PMST. The order of the arteries as they come off of the external carotid artery.